Surgeries to treat epilepsy. Epilepsy is a central nervous system disorder in which brain activity becomes abnormal, causing seizures or periods of unusual behavior, sensations, and sometimes loss of awareness. In approximately 1/3 of patients with epilepsy, seizures persist despite adequate trials of several anti-epileptic drugs. Surgery can provide seizure freedom for some patients with seizures resistant to medications. Not all patients with epilepsy are eligible for surgery. Patients with disabling complex partial seizures, with or without secondarily generalized seizures, who have failed appropriate trials of first-line anti-epilepsy drugs, and the patients referred to an epilepsy center for the reasons stated above who meet established criteria for anteromedial temporal resection and who will accept the risks and benefits of this procedure, are eligible for surgery. The preoperative assessment includes neuroimaging, electroencephalography, neuropsychological testing, intracarotid amobarbital test and invasive intracranial monitoring. The surgical strategy can be definitive or palliative depending on the case. The common surgical techniques for epilepsy surgery are listed here. Anteromedial temporal resection is the most commonly done procedure. It involves removal of the part of temporal lobe involved in seizures. The technique was developed by Spencer to preserve the function of lateral temporal cortex and to access the mesial temporal structures through the temporal pole corridor. The complications of AMTR are listed here. Corpus callosotomy involves removal of corpus callosum, and helps disrupt one or more major central nervous system pathways used in seizure generalization, thus reducing the frequency and severity of primary or secondary generalized seizures. The complications of corpus callosotomy are listed here. The aim of this non-resective procedure is to abolish epileptiform discharges and correlative seizures from epileptogenic cortex by disrupting intracortical synchronization and thereby reducing or eliminating the epileptogenic potential of the seizure focus. In functional hemispherectomy, the cortex is disconnected from all subcortical structures, and the interhemispheric commissures are divided, but the brain remains in place. The common surgical techniques for epilepsy surgery are listed here. The outcomes of epilepsy surgery vary depending on the type of surgery performed. The expected outcome is seizure control with medication. A positive long-term outcome after epilepsy surgery is possible for many patients and especially those with hippocampal sclerosis or those who had anterior temporal lobe resections.